Welcome, good morning, and thank you for joining us for this Inenco webinar, the third in a series of such online events being held this year in conjunction with Health Estate Journal, the IHEAM monthly magazine of which I'm the editor. Today's webinar will be presented by Beth Goodwin, an account manager for Inenco's NHS clients within the north of England, who acts as the main interface between the company and NHS trusts, and David Oliver, technical product and insight manager, who's a member of Inenco's solution team, which delivers bespoke energy and water services. David also provides strategic advice to customers and is a regular contributor and speaker at Inenco conferences, webinars and blogs. Our two speakers will be discussing the subject, how NHS trusts can turn compliance into an opportunity by creating an effective green plan. Inenco is a business utility company with over 50 years consultancy experience in energy and utilities management, with health and social care activity currently contributing some 4 to 5% of the UK's carbon footprint. The company warns that without a greater focus on delivering environmental sustainability across all parts of the service, the NHS's recent net zero commitment could be in peril. Accordingly, the webinar will focus on creating your green plan, going beyond compliance, how to best report on performance, using data to baseline current performance and setting evidence-based objectives, and embedding the green plan in your trust to engage key stakeholders and drive change. At the end of the presentation, Beth and David will be happy to take questions. Please submit any questions you have by typing them into the chat box to the right of your screen as the webinar progresses. Beth and David, over to you, and I believe Beth will start the presentation.
I will, thanks very much for the introduction. So hi everyone, and before we dive into the detail on green plans, as we've promised, I think it's important that we set the scene of why trusts are being asked to create them and the journey we've taken already to get here. So healthcare's climate footprint, as mentioned, is equivalent to about 4.4% of global net emissions. And the NHS actually produces higher emissions than the global average for healthcare, being responsible for about 5.4% of the UK's total carbon emissions. And we've taken that figure from the Healthcare Climate Footprint by Healthcare Without Harm in conjunction with Arabs. I'm going to pass you to David now, who's going to talk you through some of the history and some of the future targets.
Thanks, Beth. On screen now, you can see a little bit of snippets of the journey that NHS England has been taking. It all started really back in 2008, which was the original Climate Change Act. And at that time, the government was pledging an 80% reduction in carbon emissions compared to 1990 by 2050. And at the same time, the NHS established the Sustainable Development Unit, or the SDU, and tools like the Good Corporate Citizen Self-Assessment tool were first created. Then we started out this journey with the Sustainable Development Management Plan, or as everyone calls it, SDMP, being mandated in the standard conditions back in 2009. But the uptake of these was slow. So the SDAT tool was launched in 2017 to give a standard set of questions which trusts could use to assist at measuring their sustainability for their SDMP. Now, when the government committed to a net zero 2050 goal in 2019, it was clear that the NHS needed to increase its rate of progress, and NHS England have been working on ambitious targets ever since. The SDMP was rebranded into Green Plans in January 2020, with a requirement and aim for all trusts to have one in place that includes actions to deliver the sustainable development related NHS long-term plan commitments. The new branding helps to emphasise that environmental sustainability must be considered at board level. Since January, in the midst of a hugely challenging year, we've seen a raft of additional commitments. The NHS Operational Planning and Contracting Guidance 2020 to 21 committed that all NHS organisations should move to purchasing 100% renewable electricity from their energy suppliers from April 2021, an action that will have a huge impact on reducing the overall carbon footprint of the NHS. And we'll talk more about the recent 2040 and 2045 targets later. Now, before we start to go into details of those NHS targets and the wide range of emissions that need to be considered, we thought it'd be useful just to consider the carbon emission story so far for the UK, purely concentrating on electricity and gas use for buildings. And it's also, what we've done here is we've modelled a generic site, a generic hospital, which back in 1990 had electricity consumption in the order of 12 gigawatts and a gas consumption of about 15 gigawatts. So a smallish acute hospital potentially. And we did this model and we thought about its journey back from 1990 and moving forwards. And in 1990, you can see that most energy-related emissions were associated with electricity. And just to be clear on this graph, the blue bar is gas, the orange bar is electricity, and the grey bar is total emissions from the former two. And at the time, in 1990, most of our electricity was generated from coal-fired power stations, and they have the highest of all the carbon intensity factors for electricity. But in the 1990s, there was this so-called dash for gas following privatisation of the CEGB, and much of the coal generation was displaced by gas-fired power stations, and that resulted in significant drops in emissions. However, by 2005, the generation mix had sort of levelled out at around about 40% coal, 40% gas, and most of the remaining coming from nuclear. And renewables at that time were only a very small percentage of the total contribution. So with grid electricity levelling off around half a tonne of CO2 per megawatt hour in the first decade of the 21st century, one way to reduce carbon emissions and also save money was to install a combined heat and power plant. And in our example, we've assumed that a CHP was installed in or just before 2005. And you can see that this reduces electricity imports, but increases gas demand. However, the installation of CHP produced at that time an overall carbon reduction. So let's continue the journey with grid electricity. The next big step in decarbonisation started in 2011 with what was called electricity market reforms. Now, this provided subsidies for renewable projects and also led to increasing taxation on carbon, which made coal less attractive. Now, the biggest rate of change has actually happened in the last 5 years. And in 2019, the UK generated around 37% of its electricity from renewables and only 2.5% from coal, which is almost a complete reversal of what happened 10 years before that. So this has caused the carbon intensity of electricity to be less than half of what it was less than 10 years ago. So that's an incredible rate of change. However, the last 2.5% of that coal generation will finish in 2025 and all the coal plants have to be closed. And the rate of decarbonisation is slowing. It's not practical to switch everything onto wind farms. We still have to maintain certain levels of gas-fired generation, for example, or build more storage facilities. So for the NHS, the issue of carbon emissions for electricity has already been sort of addressed anyway, because from 2021, you'll be buying green electricity. So therefore, that's been counted as zero carbon. So the story on decarbonisation of electricity has effectively ended for the NHS from 2021. But unfortunately, since 1990, there's been virtually no change in the intensity factor of gas. Now, whilst you hear about green gas being produced in biomethane plants, this is a tiny fraction of the total gas use. And projects that talked about which will inject hydrogen into the gas grid are unlikely to make a significant impact in the next 10 years or more. So here's the challenge. How do you decarbonise heat? And, as we'll discuss later, what about all the other sources of carbon emissions that the NHS produces?
That's really interesting. Sustainability is certainly very high on the agenda for the NHS currently, particularly with NHS England having recently published its net zero carbon plan. Our webinar today is focused on green plans. Beth, can you talk us through what a green plan is and why it's important?
Absolutely. So yes, now we've been through where we are, it's time to get into the detail of what you actually need to include in your green plan. So it's good to be clear, this isn't just a carbon reduction plan. This is going to be a live strategy document, and the idea is that it will last between 3 and 5 years and outline your aims, objectives and delivery plans for sustainable development. It's written around the long-term plan for the NHS, and it should help you to deliver on its goals, improve the health of the local community, achieve your financial goals as a trust, and meet your legislative requirements. And since the plan needs to be board approved, it's important that it's both ambitious and realistic. So progress should be reported to the board annually, and the whole document should be reviewed at least once whilst it's live, and then resubmitted with better targets if applicable. Green plans evolved from the original SDMP, and so they take a very broad view of sustainability. The report should cover not only your environmental impact, but also social impact on your local communities and the financial impact on the trust. So if you just see on the slide in front of you now, the essentials to include in your plan is to reduce carbon, waste and water, including by phasing out coal and oil fuel as primary heating, something that a lot of you are already doing, switching to lower carbon asthma inhalers, reducing the carbon footprint from anaesthetic gases, improving your air quality, including by cutting business mileages and fleet air pollutant emissions by 20%, and reducing the use of avoidable single-use plastics. And you can see on this slide the broad spectrum that is sustainable development under an SDMP. It covers your environment, economic and social areas. So to come back, these have been built on further this year within the operational and planning guidance from 2020-2021, and it includes some direct targets, and these are designed to try and help you refine your green planning and actually give you some of the targets as suggestions of what you can set. So they've defined that you should cut your business mileages and your NHS fleet air pollutant emissions by 20%, and that targets by 2023-2024. So you'll need to achieve that within the period of your current green plan. You need to move to purchasing 100% renewable electricity from an energy supplier, and that's by April 2021. So I'm hoping most of you will have that in place already, ready for your next financial year. If not, you should really be approaching your supplier to talk about moving yourself onto a renewable tariff with your supplier. It's good to know that there's an elephant in the room here, and actually REGO backed electricity isn't necessarily the be all and end all. We will talk about that later. You need to replace your lighting with LED alternatives during your routine maintenance activities. You need to ensure that all new builds and refurbishment projects are delivered to a net zero carbon standard. And that one's raised quite a few eyebrows, and I think a lot of you are struggling to achieve it at the moment. You'll need to also implement the Estates and Facilities Management Stretch Programme and sign up to delivering the NHS Plastics Pledge. Finally, you need to reduce the carbon impact of your metered dose inhalers and reduce the proportion of desiflurane to sevoflurane used in surgery to less than 20% by volume. And that's going to be a really critical one, which we'll touch on later in terms of engaging your clinical teams. So these measures will give you a really good base for your green plan. Just simply by following the guidance, you can create aims, objectives and delivery plans around those specific targets. But we should also discuss a key tool that's available to you to assist in increasing the scope and range of your sustainability measures. And that's the SDAT, which is your Sustainable Development Assessment Tool. It's a great way to measure your sustainability across all 10 key areas. And its 300 yes or no questions are designed to give you a score with clear targets available to achieve to improve your trust sustainability. This isn't mandatory. This is the first step forward beyond the mandatory requirements of the Green Plan, but it is very good practice to include a target to improve on your SDAT score within your Green Plan by identifying areas which are currently no answers and planning a route to change them to a yes. You can see on the screen now the SDAT in a little more detail, and you can see how it might help you to start to move beyond compliance. So it's comprised of the 300 questions, as I mentioned, which go through corporate approach, asset management and utilities, travel and logistics, adaptation, capital projects, green space and biodiversity, sustainable care models, our people, sustainable use of resources, and then carbon and greenhouse gases. So each of the individual questions within the SDAT tool are actually categorized by which stage of the process they relate to. So you can see as you plot your way through from measuring and assessing through planning and engagement to the means to deliver, the outcome being achieved, and how you're communicating that outcome. When you complete these questions, you'll probably identify roughly where you currently are in terms of your sustainability progress by seeing how many in each stage you've achieved. You'd expect to see the pattern in which areas need to be worked on prior to others in order to move towards achieving a yes on the outcome question for each area. So we're going to talk a little bit now about how you'll use this score, and I'm going to pass you back over to David Oliver, who's going to run you through a single question as an example.
Well, once you have your initial score, the next step is to produce a plan to improve that score year on year. Now, we recommend that you assign a responsible person for each of the 300 questions and use the tool to drive change. Most of the responsible individuals will likely be from a broad range of areas within the trust, sitting between finance, procurement, clinical, and estates teams. They will need to take ownership of delivering improvements within their allocated questions to move as many to a yes as possible. For example, question 100 sits with travel and logistics, which is within procurement and supply chain, and asks the question about key contracts and says they should have CO2 and or NOx reduction KPIs for the delivery and logistics associated with goods and services, and that those are monitored. Now, if you've marked this as a no, at the start of your green plan, you might want to consider, for example, allocating a category manager within procurement as a responsible person to oversee the setup of these KPIs for key contracts. Now, you would set that person an individual target to put such measures in place for all new contracts. Now, this may require training, or it may require assistance from estates to write aspects of the tenders, but the appointed person would own responsibility. Now, you may also want to contact existing suppliers to negotiate adding similar sort of KPIs to their contracts. Now, realistic target dates would need to be set for the changes to be implemented, and the responsible persons would report on progress on an annual or possibly quarterly basis. Now, the 300 questions provide a great framework to improve sustainability, and it importantly devolves the responsibility from sitting simply within the estates team to covering all areas of the trust. And this shift in perspective is key to ensure change happens. Now, if, for example, within your green plan, you're targeting to change 5 responses each year from a no to a yes, we would suggest that you should be actively working on 10 or more across maybe 6 or 7 responsible persons. And that way you're in a great position to achieve your goals. Now, whilst the green plan guidance is yet to be updated, we couldn't do this presentation without discussing the recent Delivering a Net Zero National Health Service document. Now, 2 net zero targets for the NHS have been set with ambitious interim goals. These targets are based on a defined NHS carbon footprint and the so-called carbon footprint plus, which are actually shown on the graph in front of you. Now, NHS carbon footprint mandates net zero carbon for the NHS by 2040, but with an ambition for an 80% reduction compared with the 1990 baseline by 2028 to 2032. Whilst NHS Carbon Footprint Plus sets a net zero carbon for the NHS and its supply chain by 2045, with an ambition for an 80% reduction, again compared with 1990, by 2036 to 2039. Now, your green plan will need to consider these and how they might impact on your targets, and Beth will provide more details in the next section.
Okay, thanks, David. So you can see on your screens now the new NHS carbon footprint and the carbon footprint plus definitions. And this graphic's taken directly from the recent document. The NHS footprint has been designed around the greenhouse gas protocol, and it follows a similar scope within the main footprint to that that's required of the private sector under the new streamlined energy carbon reporting. So I'm going to go off topic a little bit here now, and I'm going to talk about the private sector, and there's a very good reason for that. And that's that many trusts have wholly owned subsidiary companies for their estates departments now. And if these companies are your contracting entity for your gas and electricity, and they meet at least 2 of the following criteria, which is a turnover of £36 million or more, a balance sheet of £18 million or more, and 250 employees or more, then they will be captured by SECA and they will need to follow this guidance and report anyway. And that report will need to be published with your accounts on an annual basis. So unlike ESOS, there's no exemption for the wholly owned subsidiaries for the carbon reporting requirements. A standard SECA report would cover emissions from mains gas, company fleet, company lease vehicles, mains electricity, and grey fleet. And you can see within the scope 1, 2 and 3 streams within the NHS carbon footprint that actually there's quite a lot more than that captured within the NHS carbon footprint. So an enhanced SECA, which is voluntary for private companies, would usually include in emissions from other gases, which are fugitive scope 1 emissions, water, sewerage, waste, public transportation and hire cars. And if you build those in, you can see how we've reached the NHS carbon footprint requirements. It's essentially an enhanced scope SECA. And you can see that when we consider the carbon footprint plus, it's very rare for companies within the private sector to try to put this level of scope 3 information into their footprint. And there are really good reasons for this. In theory, they should be captured by other businesses' footprints because these are upstream and downstream of the actual company or trust who are reporting. And to attribute carbon costs to some of these areas is very challenging. They're very opaque. It's sometimes hard to get emissions factors for things. So this is where your procurement department come in. And there's some very large shifts needed in how you tender and how procurement focus on what they need from suppliers based around capturing this NHS carbon footprint plus. You'll need to include some measures of your carbon footprint and the footprint plus in your discussions when you're setting targets for your green plan to reduce emissions. And these should help you to ground your plan in the wider activities of the trust and ensure that others understand that significant areas of scope sit beyond the realm of the estates department. We'll talk a lot about that later and moving beyond estates with green plans. The process of setting these realistic granular aims towards the net zero goals will require these other teams. And it might be that your initial targets for some aspects are actually simply just to identify the key personnel who are going to own a change or to begin collecting data. So to sum up for this section, it's key that your green plan isn't viewed as just a compliance piece. It's not just for meeting your NHS standard T's and C's, and it needs to become an entry point to a much broader network of sustainability measures and sensible targets within your trust.
Thank you very much for that section, Beth. That's very informative. A question here. Once trusts are actively measuring their carbon footprint, how do they best report on performance? Could you explain that, please?
I can, thank you very much. So you've been required to report on sustainability within your annual board reports since 2010. But I've been through a lot of annual board reports, and there's quite a few trusts that make no reference to gas, electricity, or in some cases even carbon within this section of the report. So given that you need to report on this performance against your green plan to the board on an annual basis, we would recommend that you make the best of this and you ensure that there's a clear and meaningful public statement being made at the same time. So depending on how far along this journey you are, you might have enough data to actually create a full annual sustainability report as a separate document. And if anyone hasn't seen them, I'd recommend that you have a read of the Newcastle upon Tyne Hospital's NHS Foundation Trust sustainability reports, as these are a great example of what you can do once you're a few years into this process. But if you're newer to the process, a page or two within your annual board report is a really good place to start to dedicate to sustainability and to tracking your green plan goals. In order to do this, you're going to need to make sure that you're gathering a lot of data. So for now, we're going to focus in on the NHS carbon footprint instead of the footprint plus. As if you're going beyond the SDAT, this is really the starting point for most of your annually trackable progress against your plan. And most trusts are likely to begin the process by reporting solely on their building energy footprint, which is your electricity imported, your gas, oil and coal burned on site. This data is very easily locatable as you already report on it within your ERIC returns. So back in 2004, the NHS used to define its carbon footprint plus as split on the screen, with building energy making up 22% of the total footprint. And if we go forwards to the current pie chart, you can see now that this actually is only 10% on the current pie chart. And this actually sort of harks back to what David said earlier about the graph of how building energy has reduced already since we started this journey. So the new chart is showing you different areas which we should track in order to understand progress towards the 2040 net zero footprint goal and the 2045 net zero footprint plus goal. You should start tracking all of the green section as soon as possible. And you're going to be prioritizing your core carbon footprint, which is essentially your electricity, your gas, oil and coal, your water, your waste, your anaesthetic gases, your metered dose inhalers, business travel and NHS fleet. And then you're going to start prioritising patient travel, staff commute and visitor travel. So once you've got data for everything in the first category and you can start tracking that on an annual basis, you'll be able to report your year-on-year progress in reducing carbon emissions from your NHS carbon footprint. And you'll do that either against your baseline year, which might be 1990, it might be 2007 or 8, or more likely, where you're recording the data, you're just going to report it from this year onwards when you've got the detail that you need. We're going to talk a bit about the issues of baselines in the section later of Elephants in the Room. So don't worry, again, we're not sweeping it under the rug. It is something we're going to address, but for now, we'll get back to what you can do. So ideally, on an annual basis, you're going to be reporting in your board annual report your progress against your SDAT scores for the year, how that compares with the targets you've set within your green plan, your progress on your carbon footprint reduction, and how this compares with detailed targets that you've set in line with the essentials and the operational and planning guidance from 2020-21 that we've talked about earlier, where we added the detail. Once you're doing this, you can then really go as far as you like. You can increase as you've got more data from procurement on the Footprint Plus and use annual trackers of progress to inform your review of your green plan at the midway point.
Thank you, Beth. As you mentioned, there's a deadline of 2040 and 2045 for the NHS to become net zero. How does the service ensure that it meets these targets? I imagine it's a case of breaking everything down into smaller objectives.
Essentially, yes. David's going to take you through that now.
So we recommend the following approach when developing your green plans. Firstly, we say, think about your ultimate targets. Work backwards from the end goal and plan how you're going to get there. Secondly, create a roadmap for your next 10-year 80% reduction goal. Then outline what needs to happen in each year of your 3 to 5 year plan. Consider the impacts of each large change and identify the barriers to progress and how you'll overcome them. So some of the objectives and targets have already been set for you, such as cutting business mileage and NHS fleet air pollution emissions by 20% by 2023 to 24. But the goals you'll need to set in your green plan will need to be aligned with awareness of your trust, its current position, and how fast you can improve. Now, a good way to do this, as we said before, is literally start at the goal, understand where you need to get to, and then work backwards to decide what you need to do and when you need to do it. Now, as an example of this approach, we went back to that hospital model we showed earlier and considered what needs to be done to achieve an 80% reduction in carbon emissions from its heating system by 2030. And this does not include the parallel challenges of carbon reductions in other areas that Beth has already discussed. Now, if you start off at 1990 with the total carbon emissions for that hospital we looked at earlier, and we draw the trajectory to 2030 at 80% reduction, that's actually the green arrow shown on this graph. And what it actually shows is, at this moment, you're not far from being on trajectory. In fact, with green procurement next year, you'll appear to be bang on trajectory. However, the site will need to take substantial additional measures in order to reach the end goal of 2030. So when looking at gas use on the site, one of the tools available at the start of the roadmap is the heat decarbonisation plan, which allows you to consider whether you may be able to source low or zero carbon heat from nearby heat networks or waste heat sources. And if so, your green plan may recommend investigation of such options. However, if the conclusion is that future heating will need to be electric, then the issue of site electrical capacity will be addressed early on. If the site does not have enough capacity to meet these future needs, then you may have to consider electrical grid upgrades or even moving some services to other locations in order to manage the demand. Now, whilst the prospect of a future upgrade to the electrical network sounds expensive, and historically has been so, don't panic. Ofgem is currently reviewing design and access costs for connections, and from 2023 onwards, we're likely to see such projects being paid for over longer periods, and that'll be done through use of system charges rather than the current process of 100% upfront payments. The first works that we recommend for all sites is to reduce heat demand through energy efficiency works, addressing poor insulation on the site, reducing drafts, and improving BMS controls. These can all help reduce gas demand and provide reasonable financial returns on investment. Another issue to address is whether your site uses steam. If so, then you should look at the efficiency of your boilers and the standing losses in the distribution system and start to plan a de-steaming programme, which is likely to be phased in over several years. However, before you replace steam boilers with systems that operate at typically 80 Celsius, stop and think about 2040. It's very likely that most of your heat in 2040 will be coming from sources at around 45 Celsius, and that will require larger distribution pipes, larger air handling units, and so on. So if you are designing a replacement system that can work with gas at the present, make sure it can be converted to enough heat pumps in the future. Finally, sometime between now and 2032, you may have to shut down what might be your biggest gas user, and that's your CHP. Switching off the CHP will reduce gas emissions from the site, but it will do that by increasing electricity imports. However, the electricity imports are zero carbon, so the net reduction in emissions is pretty substantial, as you can see on this graph. However, we all know that CHP provides significant cost savings, so you'll probably want to leave this as late as possible, unless, of course, changes in legislation make CHP unattractive before then. So, in the example on screen, we've come up with a hypothetical scenario for this site to achieve their 2030 targets, and that includes the energy efficiency measures, de-steaming, and CHP shutdowns. However, you might be lucky enough to get away with that, having to do the wholesale change to heat pumps in that 10-year period. However, you may want to consider trialling heat pumps anyway, and we recommend you look at outlying buildings to see whether you can install heat pumps at an earlier stage, so you can get some operational maintenance and optimization experience. Now, you can start to see how this will inform your green plan targets. The example trust here is theoretically missing its trajectory to meet the targets in all the next 5 years. However, it has a long-term plan to meet them and can show what actions are needed to get there and when these need to be implemented. The targets for the first green plan are around enabling research and planning, but don't actually meet the objective. That comes in a later period. The key thing here is to identify risk factors that could impact on the ability to switch off the CHP, for example, and make sure they're mitigated before it needs to be done. Jonathan?
So I'm sure that you've realised by now that there are some really key consequences of the net zero targets that may not have been thought through. And we would like to kind of discuss these a little bit more in this section, which is going to be the elephants in the room, just to touch on the things that we've skimmed over and that are actually quite key to consider when you're planning things.
David, I believe you're going to start on this with carbon footprint baselining.
Thank you. Yes, we have 4 elephants to talk about. And as you say, the first one, carbon footprint baselining. And we've mentioned before that most government targets use a baseline of 1990 as a reference point to compare current emissions against. However, we believe that's a little bit of a flawed strategy, really. As we showed earlier, all trusts can demonstrate substantial carbon reduction since 1990 due to the change in our electricity generation mix. And obviously from 2021, there'll be further reductions due to the purchase of renewable electricity. And as we've just seen, the site may already be on the straight line trajectory from 1990 to 2030, having done relatively little. Now, this creates a concern that this could lead to complacency. You know, the message is clear. Decarbonisation of electricity has been relatively easy over the last decade, but most sites have only seen small reductions in heat use. And the real 2040 challenge is to decarbonise heat, transport, medical gases, and then, of course, the wider supply chain. In our opinion, what happened in the past is not that important. All NHS trusts need to calculate the carbon footprint today, adjusted, of course, for COVID effects, and then work out a plan to achieve net zero carbon in only 20 years. And what happens after 2040, that's the next elephant in the room.
Yeah, I'm going to talk to you a little bit now about supply chain. And really, in order to decarbonise the supply chain and meet your footprint plus goals, the NHS is going to need to work out how it can persuade or even force its supply chain to meet the same challenges. Ideally, you'll hope that your suppliers will see the benefits in decarbonisation because they'll win more NHS orders. But there's a risk here that suppliers will simply meet their obligations by carbon offsetting, and with the associated costs then being reflected in more expensive supplies and services for the NHS. There's a big question of who in the trust will police the supply chain. We all know that suppliers might avoid certain taxes by locating parts of the business overseas, and it seems kind of inevitable that the tracking of carbon across continents is going to prove difficult. We touched on this earlier by picking the question around setting KPIs for carbon reductions within your supply chain to talk through in detail. And this is something that we'd encourage you to be talking with your procurement teams about now and making sure that all formal tenders that go out in future include that kind of a restriction. And I'm going to pass you back over to David to expand on carbon offsetting and why that's in the room.
Thanks, Beth. Yeah, so the NHS targets concede that it will be impossible to achieve zero carbon emissions. And so the final method of achieving net zero is by carbon offsetting. Now, currently, carbon offsets cost in the region of sort of £5 to £10 per tonne of CO2. But if demand explodes, as most of the UK and most of the world tries to go carbon neutral, then there's a real risk that the availability of carbon offsets will reduce, and that inevitably will increase the cost. So we've got to ask the question, is it appropriate for the public sector to pay for carbon offsets? Surely it'd be more appropriate for the government to use public funds to build carbon capture, for example, carbon capture and storage, of course, or for afforestation projects, all the other sort of things that the Committee for Climate Change are talking about. And finally, that leads on to another interesting question in the world of carbon, which is our fourth elephant, which is about zero carbon electricity. Now, your site or your trust may have installed solar panels at your site. And as an example, an installation of around 100 kilowatts will have generated about 80 megawatt hours over the last year and reduce your carbon emissions by about 20 tonnes. However, from April next year, the same installation will produce zero carbon savings. Similarly, any future work you do with electrical efficiency improvements will reduce your energy consumption and hopefully save you money, but won't make any difference to your carbon footprint. Now, in case you hadn't realised, the reason is because you start to procure renewable electricity in April 2021. So all electricity used on site will be counted as zero carbon. This means that any on-site renewable generation or reduction in electricity demand will only displace zero carbon imports. So the energy efficiency measures won't reduce your carbon footprint. Now, it's interesting that for businesses that report carbon emissions through the streamlined energy and carbon reporting scheme, they have to report emissions for electricity using the so-called location method. And this assumes that the electricity carbon emissions are the same as the grid average figure, which is what most of you use at the moment. Now, if their business then decides to buy renewable electricity, they can voluntarily declare an emissions factor based on what's called market approach, where renewable electricity is zero carbon, but the submission still has to include the location-based figure. And
yeah, that's key, David, isn't it? Because we can sort of take the assumption that if the NHS were to follow the private sector on this and report the location method, then maybe you'll actually have more chance of getting your projects to reduce your usage of electricity funded on site as well.
Correct, yeah. It's also, by the way, been asked for me to point out that no elephants were harmed in the making of this section.
Thank you very much, David and Beth. We've covered a lot of ground in a very interesting presentation so far. It certainly feels like for the NHS to successfully meet the targets set, everyone within trusts, which after all are very large organisations and very diverse, will have a part to play. How do you advise trusts to go about engaging key stakeholders in order to drive change?
That's a great question, and we've been through quite a lot here, and I have along the way tried to make note and signpost the fact that you're going to need other areas of your trust if you're going to achieve your sustainability targets and also meet goals that are realistic within your green plan. So I'm going to try and wrap up a little and address how to go about that here. And obviously, you know best the challenges you face within your trust, and you'll understand where your blocks are, and you'll understand where you have excellent resource that you should be able to draw on. So just to start with the assumption that most of you who are here today, who are listening in, are from the estates departments of your trusts. So you would understand the need for this already. You get sustainability, you've been reporting on it for a long time, and the green plan needs to come out of estates. It needs to become about the whole trust. So your first advantage here is the fact that you need board to sign off your green plan. And this gives you a really good reason to engage with the board sustainability sponsor and ensure that the awareness of sustainability goes all the way to the top of the trust. They're going to need to sign off on the targets that you set. So it's in their best interests to understand how you plan to meet them and to make sure that the power and the authority to ensure that happens is given to the appropriate people. So if you think back to the SDAT, setting up focus groups for each of the sections with regular meetings for granular items would help to ensure that estates don't need to oversee all of the detail of the plan. So these focus groups could be around a number of different responsible persons who are all working together to similar goals and who can then use each other as a resource without needing to constantly come back to your energy manager, your sustainability manager, which will free them up to then oversee at a higher level. So when you're allocating the accountability for different targets, it's worth considering the actions that are needed to meet the goals. So find a way to ensure that these are part of either a staff member's KPI or a department head's KPI, so that they're able to make them happen, but also responsible if they don't. So for example, if a trust has a target to change your anaesthetic gas mix, realistically, that can't be owned within the estates department as you have no input into achieving the goal. It needs to be owned by your lead anaesthetist, not the sustainability manager. And your role in estates will be to monitor the progress, and if targets are going to be missed, to find a way to recover or to report it into the board at your progress meetings so that they're aware where there are gaps in progress. When you're setting your heat decarbonisation targets to help to reach this stretch goal of the 80% reduction, you're also going to need to make sure that board are aware of risks, because these are going to be targets that are at board level and going to have a lot of focus on them. If there are risks that might stop them from being hit, they need to be presented. And most of these are likely to be financial. So for example, most of you today would not consider turning off your CHP set and moving to an air source heat pump system. There's very good reasons for that, and they're mostly related to the cost implications. So it's a good thing to drive the accountability within the trust by encouraging awareness of your targets and plans and talking to people like your head of finance, director of finance, to make them aware where in future years there's going to be a burden that they'll need to find a resource for. You can also help to drive this and make sure things happen by actually talking publicly. So it's been proven that when a target is set publicly and other people are aware of it, it's much less likely to be missed. People tend to put much more focus on something if there's an embarrassment factor by not achieving it. And that's the same within the NHS. So when you're setting realistic targets, don't be scared to put them out into the public domain, or even just tell your staff about them. So even if you're not going to go so far as to have a press release, you might still want to do training internally with your staff, making them aware of the targets you're trying to hit. And you'll probably find when you start doing this, that certain members of staff will put their hands up because they want to help, and they will help to keep their own departments accountable for their targets. So So it's been a little bit of a whistle stop there around some of the ideas we have about helping to engage other areas of your trust. And I'm sure you've got a lot of other ideas. We just want to make sure that you understand that this is key. So to summarise, sustainability in the implementation of your green plan is a trust-wide responsibility. And if you create your document with that in mind, it will not only be a compliance document, it's going to drive your trust towards a sustainable future.